we start? Is January almost over? Feels like the never-ending month, like right?
Groundhog Day.
Oh, yeah. This morning, the doctor is in. Dr. Deena Gupta-Adimoolam is a specialist in primary care prevention and a born and raised New Yorker. Now, she's here to help us check off our list of checkups for 2026. Welcome, Dr. Deena, to New York Living.
Thank you so much for having me.
This is such an important topic because, especially as women, I know I take care of everybody else.
Yes.
And then I forget to go do my own thing.
Cover yourself.
Part of that is I had a really tough time finding a doctor that I vibed with, and then getting an appointment. I welcome your words of wisdom.
Sure. So I think the first great place to start is to look through your insurance company, right? You put in your details of where you are located, what type of physician you're looking for, and then it'll give you a list of people. I think secondly is exactly what you said. You need to find someone that you vibe with. I can't tell you how many patients come to my office and they're like, thank you for listening to me. Thank you for hearing me. I feel heard. Because a lot of people feel like they don't get that vibe and they feel like they need to stick with that person. But I always recommend getting a second or third opinion until you feel comfortable.
Okay. Yeah. So now let's start with physical exams. What do we need to know when we're scheduling?
So everyone needs at least one annual physical examination, and everyone needs to know certain parameters of their health known as vital signs, right? So blood pressure, heart rate, BMI, waist circumference, and I'm going to add to that body composition.
Okay.
Body composition means understanding your fat percentage and your lean body mass. We know a lot about lean body mass and how people who have a higher fat percentage may have an increased risk of developing other issues like diabetes or having difficulty with weight loss. So I always try to give my patients that information so it helps them to achieve their overall health goals.
Right. You know what the baseline is, and then you can work from there. Okay. Lab tests. We need to get them done. Are there specific ones that we should be looking for? I know it's different for different people, but what's your take?
Yeah, so of course, if you have different risk factors for certain diseases based on your family history, talk to your doctor about the right lab test for you. But in general, I recommend everyone have a CBC, a comprehensive metabolic panel, which is basically looking at your kidney function, your liver function, your TSH, which is about your thyroid function, vitamin D levels, a hemoglobin A1C, and a lipid panel, which tells you your overall cholesterol values.
Unbelievable. And you just go in, they draw it, and that's it, and you're done.
Yeah, it's so
amazing.
Easy.
And be nice to your phlebotomists, because they wield...
And
they wield the needle.
Yeah.
Oh, it's so true. It's so true. Don't pass out either.
Right, and use a butterfly needle. You know, even I ask for a butterfly still when my veins are rolling.
I love
That's the easiest way to get your blood taken.
Easy. All right, let's talk about screenings a little bit. And this kind of varies based on ages, right? So let's start off with 20s.
Yeah, so in your adulthood, it's always important, first of all, for every age group to get screened for mental health, right? So depression, anxiety, these are things that so many people are facing these days, and it goes unnoticed. So getting screened for that is great because you can get treatment. And then specifically for your 20s, we start with screening for things like sexually transmitted diseases. We talk about drug use, alcohol use, tobacco use, and cervical screening starts at 20 for young women.
Okay. What happens in our 40s? What are some of the screenings there?
So we continue with the same screenings I mentioned, but in your 40s, you should be due for your mammogram, as well as, you know, colorectal screening. So colonoscopies, they typically start at age 45.
Yep.
All right, and 50s?
And in your 50s...
We just keep adding. We just keep adding and adding and adding.
And 10 more.
Well,
and 10
luckily,
more.
50s is really for the men. It's prostate cancer screening, and then there's also screening for lung cancer if you are a chronic smoker.
About time the men have to do something.
That's right. That's right. That's right. Huh. So, so much going on in the world. Talk to us about mindfulness. What goals should we be aiming for? Because that's really tough to quantify, I think.
Oh, absolutely. I mean, mindfulness is something that we just, you know, take for granted, especially when we're not looking at our own self-care. But I find mindfulness so important. I talk to my patients about gratitude journaling. So trying to breathe in positivity to your day-to-day life, right? So trying to find some time, either day or night, to just think about all the positive things and name just 5 and sit there and focus on that. Also deep breathing and doing meditation exercises. I have an app on my phone. It goes off every 3 hours to remind me to do some mindful meditation. So I take a break, I do some deep breathing exercises. It can be for 5 minutes, but it really grounds you and just resets your day.
Yeah.
And then being really kind to yourself. I feel like these days we're always like looking for more. We feel like we can do better, but being gentle and kind to yourself really sets your mood in a different way. And then the digital detox, I think that's big for this year.
Huge.
A lot of people scrolling on social media, getting anxiety, getting nervous. I think you just have to put your phone away, give yourself a time limit. Maybe you say 30 minutes a day, no more. And what I've actually done in my house is try to do digital-free zones, which means that maybe at the dining table, there's no phones. And in the bedroom, there's no phones. So that is solely a time for relaxation and connecting with your family and the people that are around you.
So important.
If the doctor is doing it,
we should be too.
Dr. Deena, thank you so much. That was really, really helpful information for us. I think we need to bring you back in a couple of months to see how far we've gotten with all those lipid panels and
Absolutely.
all
Checking
the
on our
rest.
screenings.
Exactly.
For more info, go ahead and give her a follow on Instagram at Dr._Deena.